Welcome to another deep dive with us. This time, we're going to be looking at something that affects us all, even if we don't always realize it.
That's right.
Health program management. And for this one, we'll be taking most of our insights from the 4th edition of Stanhope and Lancaster's Community Health Nursing in Canada.
Great source.
It is. Now, I know the title might sound a little bit on the dry side, but trust me.
Oh, yeah?
It's anything but. Think about it. Every health initiative, whether it's something as small as a local bike helmet giveaway or as big as a national vaccination campaign, they all rely on these same principles.
That's a great point.
So by understanding how this stuff actually works, we can not only appreciate all the work and thought that goes into these initiatives, but also get a better grasp of, maybe where things go right, where they go wrong sometimes, and maybe even, figure out ways that we can help contribute to positive change in our own community.
Absolutely.
So with that in mind, let's dive right in. Stanhope and Lancaster break down health program management into 4 key steps: assessment, planning, implementation, and evaluation.
Okay.
Kind of like if you think about building a house, you wouldn't just, start slapping on bricks without a blueprint, right? And you'd need the right materials, a construction crew, that sort of thing.
Yeah, and you'd probably want a final inspection, too, make sure everything's up to code.
Exactly. That's the evaluation part. So, good analogy. And just like a house needs a solid foundation, our book really emphasizes that health programs need strong community involvement throughout the process.
For sure. In fact, they have a great example in the book, the Pine Ridge Older Persons Fall Prevention Program. It really shows how important that is.
Oh, yeah. Tell me about that. I'm curious.
Well, the Pine Ridge program, what makes it so interesting is they really put community involvement at the forefront. They didn't just assume they knew what older adults needed. They went directly to the source. They conducted assessments, they held focus groups with older adults, really listened to their concerns and ideas.
Wow.
Yeah, and that community input actually shaped the program at every stage. So from the initial planning all the way through to how they evaluated its success.
That's awesome. It really shows how that collaboration can make or break a program.
It really does.
And speaking of planning, Stanhope and Lancaster talk about different models that these programs can use. They mention a few, like PAT-TH, MAPP, there's a 4-step planning process.
Yeah, a few different options.
But they seem to really highlight the program logic model, the PLM, and the PRECEDE-PROCEED model.
Those are definitely 2 of the most popular and widely used models.
So let's unpack those. What's the deal with the PLM?
So the PLM, it's known for its very clear visual approach. It kind of helps you see the big picture by mapping out the program's inputs, what you're putting into it, the outputs, which are the activities, the services you're providing, and then finally the outcomes, which are the actual changes that you're hoping to see. Okay,
so it's like a roadmap, right? You see where you're starting, the route you're taking, and where you want to end up.
Exactly. A perfect analogy. And they actually show how the Pine Ridge program used the PLM in figure 10.1 of the book. So you can really see a visual representation of how they define their goals, activities, and expected outcomes.
Nice. I'll check that out. Now, what about the PRECEDE-PROCEED model? That one sounds a little more intimidating, maybe.
It is a bit more complex, yeah. But the core idea is super interesting. So unlike the PLM, which focuses more on the mechanics of the program itself, the PRECEDE-PROCEED model really emphasizes understanding those factors that influence health behaviors even before you jump into solutions.
So it's like you can't solve a problem that you don't truly understand, right? You've got to get to the root of the issue.
Exactly. You hit the nail on the head.
So how does this model actually work in practice?
Well, it's broken down into 9 phases, and it can get pretty detailed. But the key takeaway is that it really forces you to consider things like social, environmental, behavioral factors that might be contributing to the health issue you're trying to tackle.
So, for example, with the Pine Ridge program, they wouldn't just jump into providing walkers and grab bars. They'd first look at, okay, why are older adults falling in the first place, right?
Exactly.
Maybe it's because of poor lighting in their homes or, lack of access to transportation or even social isolation, which can lead to less mobility and strength.
It could be so many things, right? And they actually walk through those 9 phases of PRECEDE-PROCEED using the Pine Ridge program as an example in Table 10.2. So if you're interested in getting into the nitty-gritty, that's a great resource.
Okay, I'll definitely check that out. Now, what stands out to you about these different planning models?
I think what's really important is that there's no one-size-fits-all, right? Choosing the right model is crucial. It really depends on the type of health issue you're dealing with, the community you're working with, the resources that you have available. So knowing the strengths and limitations of each model is key.
For sure. Now, how about for our listeners? How do you think this knowledge can be useful to them in their own lives?
Well, think about it. Maybe you're involved in, like, a local initiative to improve park safety, or you're trying to get healthier food options in your child's school cafeteria.
Mm-hmm.
Understanding these planning models, even just the basic concepts, can give you a framework, a way to approach these challenges strategically. It helps you think about who needs to be involved, what data you need to gather, how to actually measure whether you're making a difference.
Right, like having a secret weapon in your back pocket. All right, so we've got community involvement, we've got our planning models sorted. Now let's get into the actual nuts and bolts of planning a health program. Stanhope and Lancaster outline 5 key steps, and they really emphasize that the first one is super important: defining the health concern clearly and involving the target population right from the start.
Absolutely, that's crucial. And it sounds obvious, but you'd be surprised how often programs kind of miss the mark on this one.
Really?
Yeah, they use the example of an immunization program for preschool children, which is, a great idea in theory. But imagine trying to design that without any input from parents.
Oh yeah, that would be a disaster waiting to happen.
Exactly. You need to understand their concerns, their priorities, their willingness to participate. Otherwise, you risk creating a program that completely misses the mark.
So true. So once you've got a clear picture of the problem and who you're trying to reach, then it's time for those SMART objectives, right? Stanhope and Lancaster really harp on this one.
Yeah, and with good reason. SMART objectives are the backbone of any successful health program.
But what makes them so special? Fill us in.
Okay, so think about it this way. Imagine you're trying to improve nutrition in your community. Just saying, we want people to eat healthier is a good starting point, but it's too vague. It doesn't really give you a clear target. So a SMART objective would be something like, by December of next year, we will increase the percentage of residents who eat at least 5 servings of fruits and vegetables per day by 15%.
Okay, I see the difference.
Yeah.
That's way more specific and measurable. You know exactly what you're aiming for and how to track your progress.
Exactly. And you know what? They actually illustrate this perfectly in Table 10.4 of the book.
Oh.
They take the general goal of reducing communicable diseases and break it down into these really specific, measurable objectives using that SMART framework.
So SMART objectives are all about clarity and accountability. What happens when programs don't use them? What's the downside?
It's kind of like setting out on a journey without a map or a destination in mind.
Oh, I see.
You might wander around, make some progress here and there, but you're probably not going to reach your desired outcome efficiently.
That's a great analogy. So you've defined the problem, set your SMART objectives. Now it's time to figure out how to actually make it all happen. That's the planning for implementation stage, right?
You got it. And this is where things can get pretty complex because there are so many factors to consider, like what are the most effective interventions? Do you have the resources to actually implement them? Will they be acceptable to the community? It's a lot to juggle.
It's like putting together a giant puzzle, making sure all the pieces fit together to create this cohesive and effective program. And I think Stanhope and Lancaster even mentioned this interesting concept called a charrette.
Oh, yes. Charrettes are great.
What is that?
It's basically a collaborative brainstorming session, like a workshop, where everyone involved in the program, including community members, comes together to, generate ideas, come up with solutions.
I love that. It sounds really dynamic and creative. I bet some amazing ideas come out of those sessions.
Absolutely. Plus, it helps ensure that the community feels ownership of the program right from the start. So by the time you get to the implementation phase, you've already laid a strong foundation.
Yeah, it's all about that collaboration, making sure everyone's on board. But even the best laid plans can sometimes go astray, right? Which is why that final step, evaluation, is so critical.
Couldn't agree more. Evaluation is all about answering that question. Did we actually achieve what we set out to do? And if not, why not? The Public Health Agency of Canada actually outlines 5 steps for this process, and they emphasize having those clear evaluation questions right from the beginning. We could spend a whole other deep dive just talking about evaluation.
All right. That's a whole other can of worms. Maybe we'll save that for another episode.
Definitely.
But for now, let's take a quick break. We'll be back in a moment to continue our deep dive into the world of health program management. Okay, so we've talked about community involvement, different planning models, the need for those SMART objectives. Now let's dig into that final step, evaluation.
Yeah, evaluation. This is where the rubber really meets the road. We figure out, did this program actually do what it was supposed to do? Did it make a real difference? And if it did, how can we, learn from it and make future programs even better?
So it's not just about checking boxes, right?
Mm.
We're actually gathering some valuable insights that can help shape those future programs.
Absolutely. And to do that right, we got to understand the different types of evaluation out there. Stanhope and Lancaster talk about two main approaches. We've got process evaluation, which is sometimes called formative evaluation, and then we have outcome evaluation, sometimes called summative evaluation.
Okay, I'm noticing a theme here. Lot of different terms for basically the same thing. So break it down for us. What's the difference between process and outcome evaluation?
All right, so process evaluation, that's all about looking at how a program is actually being implemented.
Right.
Are things running smoothly? Are the activities being carried out the way they were planned? Are we using resources effectively? Are we reaching the right people? That sort of thing.
Okay, so it's like checking in on the recipe as you're cooking, making sure you're following all the steps, adjusting things as needed.
Perfect analogy. Now, outcome evaluation, that focuses on the end result. Did the program actually achieve the outcomes it was aiming for? Did we see those desired changes in health behaviors or, overall health outcomes?
So that's like the taste test at the end of the cooking process,
Oh, yeah.
making sure the dish actually turned out how you expected.
Exactly. And to help clarify all this, Stanhope and Lancaster give us a helpful table 10.5, it's in the book, and they use that Pine Ridge Fall Prevention Program again as a nice, familiar example.
All right, I'll have to check that out again. So when it comes to actually gathering data for evaluation, what are we looking for here? What kind of information?
Well, it can come from a lot of different places. We might get feedback directly from the people participating in the program, through surveys, interviews. We can also dig into program records, see how many people we reached, what services they used, how often. And then there are also community health indicators, like rates of disease, hospital admissions, see if there have been any changes over time.
Wow, so pulling data from all these different angles is a pretty multifaceted process to get the full picture. And I remember they had that really interesting evidence-informed practice box in the book about a participatory evaluation of sexual assault nurse examiner programs.
Oh, yeah, that's a great example.
It really highlighted how important it is to actually involve stakeholders in the evaluation process.
Definitely. In that case, they got feedback from both the patients and the providers, which helped them figure out what was working well and what could be improved.
And then, based on all that feedback, they could actually tweak the program, make it more effective, make it more sustainable, which is the goal, right?
Mm-hmm. Absolutely. It's not enough for a program to just exist. We want it to thrive.
For sure. Now, speaking of thriving, Stanhope and Lancaster outlined 7 key criteria for actually evaluating a program's success: relevance, adequacy, progress, efficiency, effectiveness, impact, and sustainability. That's quite a list.
It is. It covers all the bases. They've really thought this through.
Yeah. So they're really making sure we're looking at success from every possible angle.
And get this, they actually provide specific questions that evaluators might ask for each one of those criteria. You can find it all in Table 10.6. If you're involved in evaluating a program, that table is pure gold.
Okay, so we've covered assessment, planning, implementation, evaluation. We talked about community involvement, all those different planning models, SMART objectives, types of evaluation, data sources, criteria for success. Phew!
My brain is full.
Right. It is a lot to take in, but you know what? It's also pretty exciting stuff.
Oh, yeah. It's complex but fascinating. And ultimately, it's about using all this knowledge to create programs that actually make people's lives better.
Exactly. Okay, let's shift gears for a bit. Let's talk about those levels of prevention that we always hear about. Primary, secondary, and tertiary. How do those fit into this whole world of health program management?
The levels of prevention. Those are like foundational pillars of public health, They give us a framework for thinking about how we address health issues at different stages, and they apply directly to the design and implementation of any health program.
Okay, so give us a quick refresher on what those levels actually mean.
So primary prevention, that's all about preventing a disease or injury from happening in the first place. Think vaccinations, seatbelt laws, education campaigns about healthy lifestyles, stuff like that.
Okay, so stopping the problem before it even starts.
Exactly. Now, secondary prevention, that focuses on early detection and treatment. So we're talking screenings, like mammograms, blood pressure checks, and then prompt intervention to prevent the condition from getting worse.
So catch it early, take action before it becomes a bigger problem.
Exactly. And then finally, we have tertiary prevention. This is about managing chronic conditions, preventing complications or disability. So things like rehab programs, support groups, long-term care
So
services.
this is for folks who are already living with a health condition, and it's about making sure they have the support and care they need.
Precisely. And Stanhope and Lancaster actually give some really great examples of how these levels of prevention might look in practice.
Oh, yeah. I always love a good example. Let's hear it.
Well, for primary prevention, they talk about a community-wide cancer prevention program. It might involve educational campaigns about risk factors, promoting healthy diets and exercise, encouraging folks to get those regular screenings.
Right. So it's like a multi-pronged approach, hitting the problem from all sides.
Exactly. For secondary prevention, they use the example of an occupational health nurse who develops a screening program for cervical cancer at a workplace. The goal there is to find women who might have precancerous or cancerous cells and get them treatment ASAP.
So important. Catch it early when it's most treatable. Now, what about tertiary prevention? What kind of example do they give for that one?
They talk about the importance of follow-up care and support for women who've already been diagnosed with cervical cancer. This could include connecting them with support groups, giving them education about their condition, making sure they have access to ongoing medical care.
So it's really about providing that holistic care and support to help them manage their condition and maintain their quality of life.
Exactly. And I think these examples really show how the levels of prevention can be applied in real-world situations to build those effective health programs.
Yeah, and it brings us back to that point we made earlier. Health program management isn't just about, like, logistics and data. It's about people, right? Understanding their needs, addressing their concerns, and empowering them to take control of their health.
I couldn't have said it better myself.
This whole conversation's got me thinking about all the different health programs that are probably operating in my own community.
I bet there are tons. You just don't always realize it, right? It could be anything from a program to get older adults more physically active to a support group for folks living with diabetes, or even something like a community garden that provides fresh produce for low-income families.
Wow, yeah. It's amazing to think about how these programs can have such a ripple effect, improving the lives of individuals, families, whole communities.
It's true. And honestly, it often goes unnoticed, all the hard work that goes into planning, implementing, and evaluating these programs.
But it's clearly essential work, and it has the potential to, like, transform lives. And so on that note, let's pause for a second and give our listeners a chance to absorb all this. When we come back, we'll explore how this knowledge can help them become more involved in shaping the health of their communities. We're back and ready to wrap up this deep dive on health program management. We've covered a lot of ground, haven't we? Those core steps, getting the community involved, those levels of prevention, primary, secondary, tertiary.
It's a lot. And we saw how important it is to really plan things out, right? Using those models like the PLM or PRECEDE-PROCEED, that can really make a difference in whether a program just exists or if it really makes an impact.
So this is what I'm wondering. What does all this mean for the person listening right now? How can you use this knowledge to, be more aware, maybe even advocate for better health initiatives where you live?
Such a great question. First of all, just being aware of this whole process, that's huge. The next time you hear about some local health initiative, you'll have this whole new way of looking at it. You'll start asking those insightful questions like, okay, who's involved in this? Are they setting SMART goals? What kind of evaluation are they planning?
So it's like you're giving our listeners a secret decoder ring for understanding all these health initiatives, how they work, how they're put together.
Exactly. And even more than that, this knowledge can empower you to get involved. Maybe there's a program you're really passionate about, and now you can offer your time, your skills to help them with their evaluation or, advocate for more community involvement in the planning stages.
Maybe this deep dive will spark an idea for a program that your community needs. It doesn't have to be this big, complicated thing.
Right.
It could be like organizing a walking group for older adults or a healthy cooking class at the community center.
Love that. And Stanhope and Lancaster actually provide some really helpful resources in that toolbox section of their book. There are templates, checklists, practical tips to help get you started.
It's like they're handing you the keys and saying, go make a difference.
Right. And speaking of taking action, I wanted to share this case study from the book. It really brings all these concepts to life. It's about this occupational health nurse named Jean. And she's facing a problem that I think a lot of our listeners can probably relate to. So she works at a lumber mill, And let's just say the workers there aren't exactly known for their super healthy habits.
The classic workplace wellness dilemma: long hours, tough work,
Mm.
not a lot of time for salads and smoothies.
Exactly. But Jean, she doesn't just give up, you know? She decides to do some investigating, use those assessment skills we talked about. She sends out surveys to the employees, gathers some data, and guess what she finds?
I'm going to guess it wasn't a picture of perfect health. What were they struggling with?
Yeah, so a lot of them were smoking, working long hours, not eating enough fruits and vegetables, pretty typical stuff. But the interesting thing is, when she talked to them, many of them actually wanted to be healthier.
Oh, really?
Yeah, but they felt like their jobs made it impossible, you know?
So it's not just about willpower, like they don't know how to be healthy. It's about those barriers we talked about, right?
Yeah.
The work environment wasn't exactly supporting those healthy choices.
Exactly. And Jean, she sees this. She doesn't blame the workers.
Ah.
She sees this opportunity to actually create a more supportive environment where it's easier to make healthy choices. So she goes to the president of the mill, shows him her findings, and guess what?
He listened. He saw the value in investing in his employees' health.
He totally did. He realized, hey, healthier employees are going to be more productive, more engaged, less likely to miss work because they're sick, right? Win-win. So he gives Jean the go-ahead to develop this health promotion program. He even offers her space and resources to make it happen.
That's amazing. It's
Yeah.
so refreshing to see leaders who get it, who understand that, hey, investing in your employees' health is good for everyone.
Totally. And here's the really cool part. The book actually leaves it up to us to figure out how Jean should move forward. They challenge us, the readers, to apply all the knowledge we've gained and actually come up with a plan for this healthy eating program at the lumber mill.
Oh, I love that. A deep dive within a deep dive.
They even suggest using the program logic model, maybe create a Gantt chart to map out the activities and timelines.
So we're throwing down the gauntlet for our listeners, right? Dive into those toolbox resources, flex those planning muscles, and see what you can come up with for Jean and those lumber mill workers.
It's your chance to put theory into practice, get creative, see how you would tackle a real-world health challenge.
Maybe you'll even be inspired to take action in your own workplace, in your community.
And hey, if you're feeling really ambitious, share those plans with us on social media. We'd love to see what you come up with.
For sure, we're all about that community engagement here. Okay, before we sign off, let's just recap the key takeaways from our exploration of health program management.
So we learned it's a systematic process, right? It involves assessment, planning, implementation, and evaluation. We saw how crucial it is to have the community on board every step of the way, and how using those models like the PLM or PRECEDE-PROCEED can really help guide our efforts.
We dug into the different types of evaluation, the data that we can use, the criteria for measuring success, and of course we explored those foundational levels of prevention, primary, secondary, and tertiary.
But I think the biggest takeaway for me is that health programs, they're not just these abstract concepts, they're real-world things that can make a huge difference in people's lives and build healthier communities.
So as you go about your day-to-day, listener, we encourage you to kind of look around and notice those health programs that are already at work in your community. Maybe it's a free fitness class at the park, or blood pressure screenings at the pharmacy, even just your doctor reminding you to get your flu shot.
Those things might seem small, but they're all part of this big effort to make a healthier future for all of us.
And who knows, maybe this deep dive planted a seed, Maybe you see a need in your community that's not being met, or you're feeling inspired to volunteer or support a program that's already out there.
Whatever it is, we hope this episode has given you that little nudge to take action, to speak up for health, and to make a difference in your own way.
Because ultimately, public health is everyone's responsibility. We all have a role to play in creating healthier communities.
So keep those brains buzzing, deep divers. We'll be back soon with another topic to explore together.
Until then, stay curious, stay engaged, and stay healthy.